Bismillahirrahmanirrahim. A very warm welcome to all of you in this session of free papers presentation in this ICOHPE-2025 LUMS. I'm Dr. Gulzar Usman, Associate Professor of Community Medicine at Liaquat University of Medical and Health Sciences. And with me is Dr. Rabia Anis. She is Assistant Professor, Department of Medical Education, LUMS. So we will be conducting this free paper presentation session. So let me take this opportunity to introduce our esteemed panel of judges, and I would also invite them to come on the podium on the stage. Professor Dr. Munawar Alam Ansari, Dean, Basic Medical Sciences and Community Medicine, LUMS. And then Professor Dr. Nusrat Nisar, she's Professor of Gynecology and Obstetrics, Bilawal Medical College, LUMS. And Dr. Kiran Amir, Associate Professor of Pathology and in charge Postgraduate Medical Center, LUMS. We will be awarding the prizes to the top 3 presenters as determined by the judgment of our respected panel. They will be marking you guys your presentations, so be careful, and each presenter will have 7 minutes for the presentation and followed by 3 minutes for the question answer session. Let us begin the session, and first of all I would like to call upon the stage for first presentation Professor Dr. Hussain Bakhsh Kolachi, my teacher and our senior professor. He will be talking on curriculum development of public health, community medicine, MPH and MPhil as well as PhD courses at ISRA University experiences. Give him a big hand, Professor Dr. Hussain Bakhsh Kolachi.
Thank you very much, and to stand on the Latif auditorium is always honor, and we have been coming up and down on this stage since 1977, and this was an honor that I have been asked to deliver a few notes about my work in ISRA University. The topic is curriculum development of public health, community medicine, especially MPH, MPhil, and PhD courses in ISRA University. The introduction is that postgraduate curriculum development is a special field, and we have been discussing in the medical education since morning that education is one of the important part, whether it is a health professions or any profession. We have developed and finalized following curriculum of public health and community. These two words are interchangeable, community medicine and public health. Sometimes people think that community medicine is separate, and sometimes public health is the bigger term, I will say. So please consider it as a public health as a major subject, as we have surgery, but there are many subspecialties in it. MPH, MPhil, PhD, and also we reviewed the MCPS courses and FCPS courses, and the objective were to share curriculum development experience in community medicine, to recommend uniformity in credit hours. That please you should understand that teaching hours, contact hours, and credit hours. I think the medical education people can understand better, but the credit hour is the main thing that your course will be having the weightage at the international level. And the methodology was, I must mention that this paper was not worthy for this approval, but I think because I was professor and dean in Liaquat University, so I think they have selected this for oral presentation. Otherwise, if you will have sent this in any international conference, then the study type and other questions may not be relevant and your paper may not be accepted. So thank you, Mr. Chair, that you have accepted this paper, which was not as fine as a study, but it was an experience, so I thought I must share. So duration of the study was last year, but actually we have been working since 2014 onwards till even today we are considering reviewing and amending our curriculum. So curriculum is a continuous learning, evolving process. Few results. The curriculum must meet the criteria. This is the first important result. If you will not study the criteria of Higher Education Commission, then they will not accept your curriculum or course. If you will not meet the criteria of PMDC, this is another area. And if you are not meeting even your own university regulations and other requirements, suppose academic council, board of studies, so on and so forth, then even your course will, curriculum work will not be accepted. And CPSP criteria is more difficult, and all are charging a huge amount of any course if you want to get recognized by CPSP or PMDC, and you have inspectors and so on and so forth. The curriculum must be approved by Board of Studies, Board of Faculty, Academic Council, otherwise you will not have your curriculum approved. We have observed, this is important, PMDC, CPSP and HAG criteria are applied on the same courses, but they are not similar and standardized, so it is very difficult to start new PG program. So the new colleges or new department must learn that a new course to start is a difficult task or uphill task. Very difficult to start new PG program in public health and community medicine especially, because 95% faculty is curative, surgery, medicine, only 5% people are from the preventive side. Basic side even they don't collaborate with the preventive medicine. They think that we are closer to the clinical side, pathology, even physiology, they people. So health and community medicine in medical colleges and universities, the Sindh particularly in private sector, recently HAC has, so NOC from the HAC is a big problem, and NOC is issued if you have PhD faculty. If you have FCPS, if you have MCPS, if you have any other degree, the higher education will not issue the NOC. So PhD is a future requirement, not only qualification but requirement for such courses. NOC condition, but recently they have relaxed this condition for 5 years, so you can start your courses. So these are the few last points. Yes, these are the curriculum. You can see that MPhil is not a popular degree. Now MPH, MSPH and even BSPH is very popular, and even FCPS is not popular in community medicine, MCPS is not popular in community medicine. So MPhil is recognized more by the Higher Education Commission. Yes. Okay, this is last. So the credit hours are not equal, and even in CPSP credit hours are not mentioned in the curriculum. So this difficulty and standardized is request. Thank you very much.
Thank you very much. If there is any question from presenter, Professor Dr. Hussain Bashkolaji, you may ask. Thank you very much. And once again, it should be noted by all presenters that you have 7 minutes to conclude your presentation, and at 5 minutes, we will give you a warning ring, and then you have to conclude within 7 minutes, and then 3 minutes for the any question. So you must check the timer behind. The next speaker, yes sir. Yes, any question? Sir, from your side, if any question? From audience, someone is here. So please give the mic, cordless. Volunteer, please. For all presentations. Fine, that's fine. So collectively, we will take question answer session at the end of all presentations. You may note it down. The next speaker is Dr. Saima Siddiqui. Please come on the stage. She will be presenting on assessment of individual learning styles amongst different levels of dental fraternity at Hamdard University Dental Hospital.
Assalamu alaikum. I am Dr. Saima Siddiqui, working in the Medical Education Department of Hamdard University. Today I am here. This is my article which I am going to present today. And my topic of my presentation is assessment of individual learning style among the different levels of dental fraternity at Hamdard University Dental Hospital. So what is learning style basically is? Learning style may differ or modify with age or even by person to person. Different model has been developed over the time to indicate overall student approach to their learning and perception of the learning and teaching environment. One of the most commonly used method is work method, which is designed by Fleming and Bomme, which categorize the learning into 4 sensory pathways, like visual, oral, read and write, and kinesthetics. So to explore or adopt the new strategies of learning style to get a better understanding. Being a more practical based discipline with a more motor skill developed, dentistry has become much easier and conveniently understandable if it is proper learning strategies is required. Moreover, to make an effective educational curriculum, it is important to identify a student learning style preference. So, mostly this basically a teacher's responsibility is to identify their students' learning style. Why it is important? Because they help in their enhancement of learning, and this basically is continuously upgrade teachers for themselves and also update their student according to their learning styles. The basic objective of my study was to evaluate the learning style and learning outcome among the students of different level of study. The known system work analysis was the learning environment. The data was 235 students, which we included all level of students, like from first year to final year, house officers and postgraduate students, and all levels of faculty members from senior to junior, like from lecturer to professors. So these are the valid and known questionnaire work was used to analyze the learning outcome among the subject, and result was analyzed statistically. And we used the SPSS 24 version software for static analysis. So initial year of BDS, the results showed the initial years of BDS, the student learned more listening, added by reading and writing in the second year, while kinesthetic means hands-on activities, are more interested in clinical years, like third year and fourth year. Postgraduate student and lecturers depend more upon the kinesthetic activities, keeping in mind the interest of the senior faculty more in research. So the learning style more in reading and writing, added by kinesthetic and oral support. This is the graphic representation of our scores, mean scores of work analysis. We can see in this graph that in the first year, the students are no experience in dental studies, so they prefer reading and writing more than others. So basically study changes in learning styles and preference learning shift to one way to another with time and experience. It is need of the time to plan our curriculum with a mixed model, which include all four components in our lectures for understanding give the understanding of every level of a student. As per this graph showed, the first year students have the experience in dental studies, and then second year, the mode of slightly shift towards the listening along with the reading preference. During the clinical years, the student depends on more kinesthetic, and higher studies, as we said earlier, they are the more interested in research, so they use to blended learning by working styles, so it use visual and oral support with knowledge about the research. Basically, everything has a limitation, and my study has also limitation because we have less time for studies, so we have that some studies was time restrained, and we stopped data collection due to time saturation. And the second one is that we have the low sample size because we have the time restraint. If we use these data and we give the longitudinal study 1 year to one group of students for 4 years, so we give the better result. So we have the lack of generalizability. And if the data for the qualitative studies, the required more good result. So I conclude my presentation is that the learning style vary from age to age among the same person and a student as well as a teacher. Must understand their art of learning and deliver better result. Overall results showed that the teacher should redesign their curriculum with the priorities of all components of their student. And then the student needed more reading and writing approach, but in the later years, the learning style would be shifted towards the more kinesthetics. These are my references of the presentation, and thank you.
So question and answer is at the end. So thank you very much. If you have any question. Okay, fine. Actually, she will travel to Karachi. So if there is any question, presenter is available. Otherwise, she will leave for Karachi. So audience, if any question from this particular presentation. Okay, big hand for her. Well managed time. Thank you. Now, before I call the third presenter, I would like to share with you that this whole conference, along with this session, is being broadcasted live on LUMS Web TV as well as on LUMS FM radio. So, clapping for the team LUMS FM and LUMS Web TV. The third presenter is Dr. Kiran Fatima. Please come on the stage. She will be presenting self-assessment of active learning and critical thinking during problem-based learning and exploratory study.
Bismillahirrahmanirrahim, and a very good afternoon to all the audiences. I'm Dr. Kiran Fatima, and I'm affiliated with the Mohammed Medical and Dental College, Mirpur Khas, from the Department of Medical and Dental Education, Ibn Sina University, Mirpur Khas. Today, the topic of my presentation is the self-assessment of active learning and critical thinking during problem-based learning. This is an exploratory study, and my supervisor was Professor Dr. Shahid Shami. Active learning is a domain of learning in which students take active part while studying or during the learning process, and they enjoy the entire learning process. Critical thinking, okay. The critical thinking is, this is again the part in which the learner focus on the problem solving skill, and it improves his or her decision making, and it stimulates the curiosity among learners. The self-assessment of active learning and critical thinking, this is the validated questionnaire, and this was already used by Umatul Khoria in December 2018 in Malaysia. It has 6 items related to the critical thinking, and it has 8 items related to the active learning. We already have an idea that problem-based learning comprised of 7 steps, and it focused on the goal setting while the inquiry-based approach. It has various numerous learning strategies, which is rated based, and at the end, the entire evaluation process of learning is being taken by the immediate feedback. And at the end, students and learners are able to assess themselves. So the rationale of this study was to investigate the strengths and weaknesses during problem-based learning and to assess the educational intervention of PBL at Bahria University Dental College, where this study was conducted. It was hypothesized that critical thinking and active learning enhances with the passage of time during problem-based learning. This study was focused that PBL enhances students' perception of their active learning and critical thinking skills with time. And other objective was to validate the self-assessment scale in this local context of the university. This study was conducted after through ethical approval from the subjects, students of BDS, and from the author of this validated questionnaire, Dr. Mohammed Umatul Khoria, by email in 2018 December. This study was actually conducted in 2 phases. During first year, after the PBL conduction of first module, and at the same time of first phase, 4th module after PBL process, this study was conducted, and the self-assessment of active learning and critical thinking skills was conducted at that time. The same scale was run after the PBL conduction during the 3rd module and in the 6th module of BDS. So actually 2 years of BDS were targeted, first year BDS and the second year BDS, and the time span which was in between was 6 months. All the methodological approaches were appropriate, and the sample size, the data was analyzed on SPSS version 23. The inferential statistical analysis was conducted at the p-value of less than 0.05. For the validity, Cronbach alpha was used. The result depicted that total 86 students of BDS had responded. From first year, there were 41 students, and from the second year, there were 45 students. The results revealed that in Module 1, the mean value was 62.26, and in the 3rd module, after 6 months of data collection, there was a clear-cut difference in the self-assessment scale, which was 87.53. In second year, The modular one, there was the self-assessment reading mean scale was 61.15, and after the third module that was 83.04, and there was a statistically significant result was found. And again, that second objective was to validate this question. So this questionnaire was valid for the self-assessment of active learning and critical thinking in this population of dental students of Bahria University. These were the parallel studies which entails that student perception of active learning and critical thinking enhances with time, and by the regular self-assessment, the other skills like productive thinking, self-directed learning, and reflective thinking is also enhances. There were the limitations that this study was conducted, this scale was used after being exposed to the PBL process, and we can strengthen the study by taking the control group as well. The unequal distribution of male and female participants was the confounding variable. And this was the conclusion that active learning and critical thinking enhances with time, and self-assessment of active learning and critical thinking scale was found to be a validated self-assessment tool with the problem-based strategy in our local setting. And this is a reference. This paper is already published in Journal of Pakistan Medical Association in September 2022. Thank you so much.
Yes, thank you very much. A nice presentation, Dr. Kiran Fatma, and Dr. Kiran is also requesting because he has to leave for Mepukhas. So if there is any question, quick question, you may ask. Yes, certificate distribution ceremony is also at the end. Yes, yes. So please, better to stay. Thank you. The next presenter, I would like to call upon the stage, Dr. Anam Bakar. Please come on the stage. And she will be presenting comparing dental undergraduates' perceptions regarding case-based learning and problem-based learning, a Karachi multi-center survey. Big hand for Dr. Anam.
Assalamu alaikum, very good afternoon, and to my audience. I am starting with this beautiful ayah that Allah does not burden a soul beyond that it can bear. I am Dr. Anam Bakar from Bahria University Dental College from Karachi. Here for the oral presentation on comparing dental undergraduates' perception regarding case-based learning and problem-based learning, a Karachi multi-center survey. These are the table of content which I will be presenting. So, traditional learning versus innovative learning. What would you choose? I am sure innovative learning. Because traditional lectures in higher education are highly criticized for lacking student engagement and hindering essential skill developments like critical thinking and collaborative learning. So innovative teaching strategies like problem-based learning and case-based learning have gained attraction in modern medical education. The objective was to compare the dental student perception of case-based learning and problem-based learning across diverse institutions of Karachi. It was a cross-sectional analytical survey which was done at multi-center institutions comprised of sample size of 317 participants using the convenience sampling technique. Third year and final year undergraduate dental students who had the exposure of PBL and CBL were included in the study, while the participants absent on the day of data collection were excluded. Self-designed close-ended questionnaire was validated through pilot study and was used. Descriptive analysis was done and independent t-test was used to see the association between the variables. This whole protocol was approved by the local institution committee and the permission was taken from all the data collection institutions. These are the demographic of the participants that states that 79% female and 20 male were included. 51 fourth year and third year 49% students were included. So, case-based learning was seen as a favored learning approach, that is 68%, and a student preferred for clinical years, leaving problem-based learning for preclinical years. The benefit reported were the higher knowledge level, interacting with real-life scenarios, reducing self-study time, understanding course objective easily, enhancing decision-making skill and time management, while enhancing critical skill, problem-solving and communication skills were seen as benefit for problem-based learning. This slide shows the significant variation among the responses of the students between the different institutions, and we found the significant variation among these 4 items, that states the interesting teaching strategy, usage of resource material, enhancing communication skills and self-directed learning. So, the comparative analysis of student perception, highlighting benefit and drawback of each method, that improved the generalizability of this research, and the usage of self-constructed questionnaire were the strength of this study. Missing faculty perspective, lack of cross-disciplinary comparison were the possible limitations. So in future, qualitative research should be done, including the faculty perspectives. So in conclusion, majority dental undergraduates express strong preference for CBL for acquiring clinical science knowledge and its practical application, while PBL is critical for developing problem solving, critical thinking and communication skills. Thank you so much for your patience.
Thank you very much, and very well managed time. Nice presentation. And now the next speaker. You have also. She's from Karachi and she has to leave for Karachi. So if any question, certificates will be given at the end of session. Thank you very much. The next speaker is Dr. Saadat Memon. Emotional intelligence, the antidote to burnout among educators of public sector medical university.
Assalamu alaikum everyone. I'm Dr. Saadat Memon, Assistant Professor from Pharmacology Department. I've done my MBBS and MPhil in Pharmacology, and I'm doing my Masters in Health Professions Education under the supervision of Dr. Hudaybiya Allah Bakhsh. Okay. I'll be sharing the insight from my study, that is Emotional Intelligence, the Antidote to Burnout among Educators of Public Sector Medical University. Emotional intelligence is to understand and manage one's own emotion and other people's emotion. There are different components of emotional intelligence like well-being, self-control, emotionality, and sociability. So emotional intelligence is crucial for professional success and well-being, especially in high-stress fields like medicine. Medical teachers in clinical and basic medical sciences, they face very unique challenges like heavy workload, balancing teaching, research, and clinical duties. So all these stressors can contribute to burnout syndrome in medical teachers. Basically, burnout is a state of emotional, mental, and physical exhaustion. Basically, burnout is a state of emotional, physical, and mental exhaustion due to the prolonged and continuous stress because of their duties and all the responsibilities. So despite its importance, the relationship between emotional intelligence and burnout remain underexplored in medical teachers of public sector medical university. So these are the objectives of my study. We compared the emotional intelligence between the two groups, clinical teachers and basic medical science teachers. We compare the burnout scores or levels between clinical medical teachers and basic science medical teachers, and we assess the relationship between emotional intelligence and burnout. So our study was comparative cross-sectional study. It was conducted at the Department of Medical Education. It was for 6 months. We used the sampling technique as non-probability convenience sampling. We have calculated the sample size using the sample size formula, that is 246 participants. We divided those participants into two groups. Group A comprised of 143 teachers from the clinical side, and Group B was comprised of 143 teachers from the basic medical science. So we use variables like emotional intelligence and burnout and their subscales. We use these 3 questionnaires to collect the data. So to assess the emotional intelligence, we use the trait emotional intelligence questionnaire, short form of this questionnaire, which was comprised of 30 questions. Then we assess the burnout levels by using the Maslach burnout inventory, which is also called as BMI, MBI, and it was comprised of 22 questions, and we also recorded the demographic variables. So we analyzed the data by using SPSS version 23, and we assessed the relationship between emotional intelligence and burnout by using the Pearson correlation coefficient test. And p-value less than 0.05 was considered significant. So these are my results. They are showing the age distribution. This table is showing the age distribution between the two groups. The mean age was 37 years in clinical medical teachers and 47 years was in basic medical teachers. These graphs are showing the gender distribution in both groups. There were 60% females and 40% males in clinical medical group and 70% females and 30% males in basic medical science teachers group. This table is showing the comparative analysis of emotional intelligence and its subscales. We can see that there is no statistical difference in the results of emotional intelligence and well-being in both the groups. P-value is more than 0.05. But there is a statistical significant difference in self-control and sociability in the results of both groups. The p-value is less than 0.05. This table is showing the comparative analysis of burnout subscales. The result of all the subscales like emotional exhaustion, depersonalization, and personal accomplishment, in their results there is a statistical difference between both these groups. This table is showing the correlation between emotional intelligence and burnout. We have used the Pearson correlation test to assess the relationship, which is showing the negative value. That means there is inverse relationship between emotional intelligence and burnout. This is the scatter diagram, which is showing the correlation. And finally, we have concluded that there is significant inverse relationship between emotional intelligence and burnout in medical teachers. That means more than emotional intelligence, less will be the burnout. So while overall emotional intelligence was similar between both the groups, but burnout levels were more in clinical medical teachers. So our study highlighted the need for intervention to increase the emotional intelligence in the medical teachers, which will decrease the burnout. These are the references. Thank you so much.
Thank you, Dr. Saadat Mehman, for a nice presentation. And the upcoming presenter is our senior teacher and well-known surgeon, Professor Dr. Abdul Ghani Sumro. Please, sir, come on the stage. And he will be presenting implementation of electives at Bilawal Medical College.
Slide change करेगा किंतु है ना? Yes sir. This one. Full screen दो ना. Bismillah ar-Rahman ar-Rahim. So, feel highly honored to be on this podium. The journey started 1976 from this prestigious institute, and my current position is presently serving as Professor of Surgery, Bilawal Medical College. Being a medical education conference, I have been certified CHP in 2023. See, my study is the implementation of the electives at Bilawal Medical College. The electives supplement to the core curriculum of undergraduate health professions education. The electives provide an opportunity for transformative learning. Electives appear to be a supplement to the main curriculum, both basic and clinical sciences in health professions undergraduate study. Electives help enhancing personal and professional development of undergraduate in diverse areas, different areas, variable, and were different from the normally used the clinical and the basic areas. Electives permit the student to think a career beyond examination and offer a student a stimulus to think laterally and creatively, besides laying down the foundation for future professional pathway. Also, electives let the student to match their aspirations with the ground reality in a field of their dreams, being a healthcare professional. Yet, there is no consensus. आम आदमी के लिए electives की definition for being a doctor है क्या? Definition of an elective, but the term infers a period of time during undergraduate study within which there is a significant element of choice. जैसे हाउस जॉब में खास जगहों पर रोटेट करना पड़ता है, लेकिन electives are different from those. So methodology, the objective of this narrative was to describe the implementation of electives at newly established Bilawal Medical College for boys. Documents related to planning, approval, curriculum, implementation, and feedback were explored for assessing and describing the implementation of the electives. All authors were actively involved in the implementation of the process. A concrete policy for the electives was deployed by health professional educations and got approval from the worthy Vice Chancellor. Though it was, Bilawal was newly established, but we did started that. Committee for implementation of electives was constituted subsequently. Brief curriculum was developed. हमने उसका curriculum develop किया कि electives में बच्चों को क्या-क्या समझना चाहिए. In consultation with the department where students have to be posted for the electives. A feasible and achievable implementation plan was formulated, focusing on the activities to be done before, during, and after the placement of students for electives in different departments. Fourth year students were oriented, जब उनकी vacation का time था तो हमने उसको consume किया and given the option whether they have to do electives at BMC, organize a structured program for electives, or explore outside in some other institute. Some of the students, they opt for other institute. The first batch of students studying in the fourth year of MBBS scheduled electives in year 2022 and second batch in 2023. अच्छा electives plan क्या था? Slab 1 हमने select किया hematology, thalassemia, bone marrow, the microbiology test, histopathology, blood transfusion, fine needle aspiration, molecular labs, X-ray interpretation, and the ultrasound. This was the slab 1. The slab 2, उसमें emergency care. Student जो है ना casualty में fourth year वाला, वो they don't go into the casualty department. The slab 2 was the intensive care, physiotherapy, minimal invasive surgery, endoscopy suite, immunization of the children, care of the TB patient, rehabilitation, hemodialysis, health care and basic. हम बच्चों को लेके गए, basic health care में हम लेके गए थे, वहाँ पे हमने उनको दिखाया था. The students were divided into A, B, C, D and G groups. They were given slabs with a draw. हमने कोई policy बिल्कुल clear cut crystal policy थी. Students were provided accommodation, hostel election इनके दौरान जब ये होते हैं, vacation होती हैं, elections होती हैं, तो बंद होती हैं, तो हमने उनके लिए खास तौर पर hostel accommodation provide की. They were assessed as per a logbook. We created a logbook along with the consultation of the department heads, and they were certified at the end. Appreciation letter to the internal supervisors. जिस जिसने हमारे तावन किया, lumps में, बिलावल में, उनको हमने certificate दिया. The conclusions are, considering the electives an important component of the undergraduate medical training, BMC organized electives program for its first batch of the students. The program achieved its purpose with the development of the tangible policy for electives, concrete, feasible, and achievable implementation plan, and involvement of the all stakeholders, students, faculty, administration, parents, and collaborating departments and their faculty. Smart and smooth process of the implementation adopted before, during, and after placement of the students for the electives. Meticulous supervision, daily they were observed. हमारा external supervisor जाता था, बच्चों को देखता था, and monitoring during the placement contributed towards the success of the program. These are the references, and I thank you for patient listening. Thank you.
Thank you very much, sir. Nice presentation and timely managed. The next speaker is also a professor of Liaquat University of Medical and Health Sciences from Department of Anatomy, Professor Dr. Pushpa Goswami. Give her a big hand. And she will be talking on exploring the perceptions of diversity and inclusion among international students in the Department of Anatomy, LAMS Jamshoro.
So with a very good afternoon, it's Dr. Pushpa Goswami going to present my study, Exploring Perception of Diversity and Inclusion Among International Students in the Department of Anatomy. I completed this study with my co-authors, Dr. Famida Gul and Dr. Farhana Rajpur. The idea of this study arose after celebrating last year the World Anatomy Day themed on diversity in teaching anatomy. After this, Liaquat University is hosting about 15 to 20% of the international students in each batch each year. So and anatomy being their major subject, we are coming across a frequent interaction with them. So I have this idea to interrogate with them regarding their particular issues or the challenges they face, such as cultural adaptation, language barrier, and integration into the academic and social communities in order to make their learning environment conducive and to attract the more students in future. The objectives of this study were to explore the perception of international students regarding the current diversity and inclusion practices in the department, to identify the barriers that international students may face in the department, to provide recommendation for enhancing diversity and inclusion practices in the department. This descriptive study was conducted in the Department of Anatomy. Non-probability purposive sampling was employed to recruit the international student, which make the number of 57, as they are the students of anatomy, which is taught definitely in first year and second year of MBBS. After they're explaining the methodology of their study and the purpose, their verbal consent, a pre-designed questionnaire was utilized to collect the data. Google Translator, wherever required, is used, and the principal investigator collect the data. As this is the descriptive study, so descriptive analysis that was performed, that was the frequency and the percentages they are calculated. So regarding the study population, we have majority of the students from Sri Lanka, which makes the number of 29, followed by the students from Jordan, the 10 students they are this year we have. Then from Palestine, we have 6 students, followed by Yemen, the 4 students. This year, we have from occupied Jammu and Kashmir, 4 students, from Mauritius, 3 more, and from Maldives, a single student is also being there. Among other variables, the 3 important or highlighted, they are notified that this the inclusiveness of the curriculum, that is majority of that opinion that the curriculum in anatomy is inclusive, and they are very satisfied with that. Regarding teaching methodology in the anatomy curriculum, that is also the second, their most favored that is being there, that is their satisfaction level is quite among the major students. The barrier that is identified, that is the language barrier that they are feeling hampering their academic excellence or their inclusiveness in the department or in the culture, what we are saying. And that is identified by 95% of the students, as we have majority of the students from the Sri Lanka. The Sinhala and Tamil is their local language or native spoken language, while majority of the Arab country, the students from the Arab countries tend to speak Arab, and they are facing this language barrier more than Sri Lankans, probably because they have their pre-meds in Arabic rather than in English most of the time. So we are concluding this with the majority of the students, they are satisfied with the teaching methodology in anatomy. They are feeling comfortable in participating in anatomy. There is a strong peer support for diversity and inclusion among them. And the addressing language barrier and providing additional cultural support could help foreign students to overcome challenges in adaptation to the program. When I was negotiating with them regarding this questionnaire, they are said after translation, "Ye to hamare dil ka awaaz hai." So thank you very much. These are my references. Thank you for listening me.
Thank you very much. A very well articulated and well managed presentation. Now the next speaker is Dr. Noorus Sahar Siddiqui. She will be presenting on transforming emergency airway management education, integrating the point of care ultrasound for skill enhancement and patient safety.
Assalamu alaikum. Good evening, everyone. Good afternoon, sorry, everyone. My name is Dr. Noor. I have recently completed my FCPS2 in emergency medicine from LUMS, Hyderabad. A brief overview of my 5 years journey as a resident. I started at JPMC Karachi, then went to Dublin, Ireland on CPSP scholarship and had 2 incredible years of training over there. And with the effort of our worthy Vice Chancellor, Sir Ikramuddin Ujjan, and my mentor, Sir Mahmood Somro, I completed my FCPS2 training now. And today I am here to share my quality improvement project that I have done in last 6 months of training, that is integrating POCUS for airway management. That simply means using ultrasound for airway. So let's start. As we all know, airway is the first and crucial step in management of a critically ill patient. So when I started my journey in lungs, I identified there are certain risks in identifying the tube conformation because we lack capnography and the gold standard methods. So I did a small survey that is shown here in the slide, and I recognize that we, just a second, and I recognize that we can do the small survey to identify what we can do in our setup. So I started literature review, and with the literature review, I recognize that we can have ultrasound as an effective tool for confirmation of endotracheal tube. That is shown here, and I added few that are recent one. These all literature review and my lead to this QIP objective, that is to utilize POCUS for confirming endotracheal tube placement. That simply means using ultrasound for confirmation of endotracheal tube. So as you can see in the picture, the central picture is showing that you can put the ultrasound probe on the neck and you can have either two images. The left one is showing a single opening, that means the tube is in the trachea. While on the right side you can see there are two openings, that means that trachea is in the esophagus. So it's a simple non-invasive technique and that gives you information in a second that is your tube is right or not. So after that, I started my QIP methodology, that is plan, do, study, and act. So in the plan, as I already identified the gap, we started teaching and academic lectures. We started one-to-one sessions and online teaching schedules too. And after that, once our doctors and staff are trained, we started our intervention, that is implementation of POCUS for airway in 50 patients. And after that, we analyze the data using SPS and Excel. Now, our future plan is to continue this cycle to see how much information we still need to confirm the tube. Now, these are my two performa. One is before the implementation of the POCUS, and one is the after implementation of the POCUS. Before POCUS, the main goals were to confirm that how much time it's taking to confirm the tube, and second was how much tubes are misplaced. The same we check on the post-POCUS. So these are the criteria that we include in our study, mainly the adult population as we work in the adult emergency, and any patient who is coming with the trauma or cervical neck injury were excluded from the study. Now the results are shown here that are massive, and you can see there are two results. One is time to confirm the intubation, and one is this reduction of the misplaced EDT. For the time to confirmation, I'm sorry the graph is not showing properly here. So average time before the POCUS confirmation was around 6 minutes. That has reduced to less than 1 minute after implementation of POCUS. So you are saving 5 minutes in emergency medicine. That is significant, where every second counts. Then this reduction of the misplaced EDT before the POCUS was around 14, that reduced to 4. So you reduce almost 73% chances of misplaced EDT. That is also a significant result. Now, the main outcome from my study are, first of all, we enhance the skill of our staff and doctor. They become more confident in dealing airway, especially difficult airway. Then it also ultimately improves the patient safety, that is our centered in emergency department. And in the last, as I shown in my result, it increases the accuracy and confirmation of endotracheal tube. So in conclusion, in summary, POCUS is transforming airway management in emergency department. It gives you real-time, reliable, and feedback information of the EDT placement. It enhances the patient safety. So our future plan is to continue POCUS as a PDSS cycle for the next 6 months and implement ultrasound as a standard practice in the lumps overall for the airway management. These are my references. These are the people I want to acknowledge for this. Thank you so much.
Thank you very much. A nice presentation, Dr. Nourasul Sahar Siddiqui. The upcoming presenter is Dr. Faraz Khan. He will be talking on evaluating the impact of peer monitoring on academic development in clinical sciences. Dr. Faraz Khan. Put your hands together just to show your presence.
Assalamu alaikum. A little disclaimer, Dr. Mohammad Faraz Jokyo, not Faraz Khan, assistant professor, orthopedics. Evaluating the impact of peer mentoring on academic development and clinical sciences. Clinical sciences at the intersection of medical knowledge and patient care demand not only academic excellence but also the cultivation of practical skills, empathy and a commitment in lifelong learning. Recognizing the complex and multifaceted nature of the fields, educators have long sought innovative approaches to enhance the educational experience of budding healthcare professionals. One such approach that has gained prominence in recent years is peer mentoring. My rationale was, study suggests that efficacy of peer mentoring to enhance academic development within the realm of clinical sciences education. There is a notable gap in empirical research, specifically evaluating its impact in this field. Given the rigorous and multifaceted nature of clinical sciences curricula, understanding the benefits and limitations of peer mentoring is crucial for optimizing educational outcomes. Objective was a study to evaluate the impact of peer mentoring on the academic performance, professional development, and confidence of mentees. Peer mentoring, what is peer mentoring? It's a developmental relationship where individuals with similar academic, professional, or personal experiences provide guidance, support, and encouragement to one another. Peer mentoring involves both experienced and less experienced residents collaborating to enhance academic performance. There are two types of peer mentoring, formal peer mentoring and informal peer mentoring. We have focused on informal peer mentoring. Informal peer mentoring is more flexible, spontaneous, and less structured. The mentoring relationship is initiated based on mutual intersects or needs and is not necessarily governed by institutional policies. It is characterized by a spontaneous relationship, flexible interrelation, voluntary participation, mutual benefits, no formal outside and informal feedback. Impact of peer mentoring. Impact of peer mentoring was measured in terms of academic performance, professional development, and confidence of postgraduate residents. Study was cross-sectional descriptive study. Conducted at Liaquat University of Medical Health Sciences, Jamshoro, duration from 15/7 to 15/10/2024. A total sample size of 50 postgraduates was included. Sampling technique, non-probability purposive sampling. Inclusion criteria, PG students of any gender enrolled in surgical and allied sciences actively participate in informal peer mentoring. Exclusion, participants who did not provide informed consent for their data to be utilized in the study, or students who are not involved in any peer mentoring during their study period. The study was performed with the approval of Ethical Committee of LMC, Health Sciences Jamshoro. Participants were selected through purposive sampling technique from the Liaquat University Hospital, Hyderabad, Jamshoro. All those fulfilling the inclusion criteria were selected in the study. Surveys were administered to all participants to gauge their perception of the peer mentoring effectiveness, relevance, their experience, perceived benefits, and challenge associated with peer mentoring. Data was analyzed by SPSS 24. Mean and standard deviation were calculated for quantitative variables. Frequency and percentage were computed for qualitative variable related to academic performance, professional development, and confidence of PG students. The mean age calculated was 29.32. Specialties was selected, but it was all surgery and allied because I also belong to surgery. So general surgery, orthopedic surgery, neurosurgery, and plastic surgery, urology. Residence years, first year, second year, and third year. Gender distribution was 46% female, 54% male. Overall satisfaction was very much satisfied, 24% satisfied, 20%, neutral 4%, dissatisfied 2, very dissatisfied 0. Improved understanding of concept, significantly improved 30, improved 16, no change 4, declined 0. Boosted confidence, significantly boosted 20, boosted 22, no change, and decrease 0. Academic performance, excellent 48%, very good 40%, good 12%, and fair and poor. Self-efficacy and confidence, again you can see it has increased with the peer mentoring. People strongly agree and very confident, 28 and 30. Peer mentoring significantly enhanced academic performance, understanding of clinical science concepts, and self-efficacy among postgraduate residents. The program fosters academic development, builds confidence, and provides mentees with critical support in clinical sciences. These findings supports the integration of structured peer mentoring program within postgraduate clinical training curricula. Future research could explore the long-term effects of peer mentoring on PG residents, clinical competencies, and career trajectories. I will also attempt to establish a formal peer mentoring program and assess its effectiveness and enhances academic and professional development. These are my references. Thank you very much.
Thank you very much, Dr. Faraz Jokhio, for a nice presentation. And the next presenter is Dr. Inayatullah Memon. He will be talking on interprofessional education, bridging two poles closer.
Good afternoon to all worthy audience. I am Dr. Inayatullah Memon. My presentation is on interprofessional education and training, bringing two poles together, and these two poles are quality care and cost effectiveness. I am Dr. Inayatullah Memon from Indus Medical College. I am their Professor of Pathology and Director of Medical Education. Today we'll talk about quality care, three main factors: quality care, cost effectiveness, and interprofessional education. Unfortunately, in our country, like Pakistan, which are low income or middle income group, there is a high rate of mortality, and because of that, the productivity, the economic productivity, where we have to maintain the quality of care, which has four main components: that we provide right care to the right time and at the right place by the right healthcare professional. And these are very costly things which we can't provide at our financial status that which we have. Because of that, we can apply cost effectiveness to that. But to apply the cost effectiveness to these costly aims or objectives is a difficult issue. That's why today we'll talk about a tool of education that is, which has been recently formulated. It is IPE, or interprofessional education. The quality care we need because of the because in the low or middle income countries, due to poor quality care, about 5 million people die, 5% people die because of this poor health of state, and the resulting death is about, the resulting consequences that about 1.4 to 1.6 trillion dollars is a loss in economic loss. And WHO places Pakistan, like many other countries, in the lower income group, and very unfortunately, we are at the very bottom of that. It is 124th number out of 169. Now we have to apply the cost effectiveness tool to the quality care so that we can achieve the quality care. The definition of quality, the cost effectiveness may be mentioned as achieving a desired outcome at the lowest possible cost. And it is a measure of how well the resources are used and are aligned with the results achieved. Now, we have to bridge these two objectives, that is quality care and the cost effectiveness. For that, IPE, the interprofessional education, is a relatively new tool which was employed or initiated in 1960s or 1970s in USA. When students from two or more professionals learn about, from, and with each other to enable effective collaboration and improve health outcomes. IPE prepares the member of the workplace, I mean the healthcare people, in a collaborative practice in the healthcare setting. The cost effectiveness and interprofessional education, we both combine together. The IPE training offers an excellent opportunity for healthcare professionals to three factors. Number one, enhance their skills, collaboration, and learn in a real clinical setting. Results are outstanding performance if IPE has been used or employed by the teams in hospital settings. This is IPE, interprofessional education, where people from different professionals, I'm not talking about interdiscipline or multidiscipline, but interprofessional means from different professionals, that is medicine, physiotherapy, pharmacy, dentistry, and allied professionals. When they all work together, they make the job easier. They can provide the job at the spot in a very economical way. These are the main components which can collectively work together in IPE process, that is School of Nursing, Graduate School of Biomedical Sciences, Public Health, Medical School, and etc. This is the chart that I have developed to combine the cost effectiveness and standard of care. Here, the cost effectiveness and the standard of care, it is very difficult. It is very, different cost to meet these two poles together. But now look here, this is also summary of my presentation, that interprofessional, the two poles, that is quality of care and the other is the cost effectiveness. When they both combine, the situation becomes difficult. But on the upper portion of the slide, the interprofessional education or training, that is IPE, brings two poles together, and this IPE connects the both together, and ultimately we achieve our goal, that is good standard of care in the financial states or the financially constrained countries by implementation of IPE. And in the end, I will suggest that IPE may be included and implemented our undergraduate and postgraduate studies. Thank you very much. These are my references. Thank you.
Thank you very much, Dr. Inayatullah Memon, for your good presentation. And the next presenter is Dr. Atir H. Rajput. He will be talking on exploring the factors affecting empathy erosion among medical students at public sector university. Put your hands together for Dr. Atir.
Assalamu alaikum, everyone. Thank you, Dr. Gulzar, for introducing me. Assalamu alaikum to the panel of experts and all my teachers and colleagues. Ladies and gentlemen, my name is Dr. Atir Hanif Rajput, and I am presenting my dissertation study. I am an MHP scholar and assistant professor at Department of Psychiatry and Behavioral Sciences, LUMS. My co-author is Dr. Hudaybia Labaksh, who is my supervisor in MHP as well. The title is Exploring Factors Affecting Empathy Erosion Among Medical Students. Empathy is the ability to understand and share the feelings of another person. It involves being able to put oneself in someone else's shoes and imagine how they are feeling. It is very crucial, very essential component of medical practice, and it is very important for medical students to develop and maintain empathy throughout their training for better patient care, improved communication, and reducing burnout and compassion fatigue. Studies have shown that empathy levels among medical students decline during their undergraduate years. This decline in empathy among medical students can result in poor doctor-patient relationships, lack of understanding for patients' complaints, leading to poor patient outcome and physician burnout and decreased sense of well-being. While several studies have demonstrated reasons of empathy decline among medical students in other countries quantitatively, there is a generally lack of qualitative exploration of empathy decline worldwide. In Pakistan, a very few studies have been conducted in Pakistan on teaching empathy in clinical practice, but very little has been known about the factors affecting empathy decline in a specific Pakistani context, which lead to understanding this idea that the study should be developed or designed to fill this gap by exploring the factors that contribute to empathy decline among undergraduate medical students in Pakistan over time. So this gives us the idea, and we planned this study to identify the factors contributing to empathy decline among undergraduate medical students at a public sector university, that is the Liaquat University of Medical Health Sciences, Jamshoro. We hypothesized that there is an empathy decline over the years in undergraduate medical education, and the empathy will be lesser in higher educational years like fourth and final year than in the first and second year. So operationally, for the research purpose, we define empathy erosion as empathy decline, a phenomena particularly noted among medical students during the course of their education and practice. It was measured by Jefferson Scale of Physician Empathy Student Version from initial basic medical sciences years to the final clinical years. The scale is validated, and it consists of 20 items of 7-point Likert scale. 1 denotes for strongly disagree to 7 strongly agree, with a Cronbach alpha coefficient of 0.89 showing a high internal consistency. The score ranges from 20 to 140. These are the categorization and interpretation of the scores. Specifically, a score of 110 or more denote high empathy levels. So it was a mixed method approach with convergent, parallel type and simultaneous data collection. The study setting was Liaquat University of Medical Health Sciences. There was 302 medical students were included in the study, 151 from the initial years and 151 from the advanced years, 4th and 5th year. This is the method of sample size calculation. We took the mean differences in empathy from the article by Tariq in 2017. So the study the duration of study was around 4 months. We used non-probability convenient sampling, and we used Google Forms for collection of data. All the students who are studying at Liaquat University of Medical Health Sciences for more than 6 months are included in the study. The students who are unwilling or not providing consent were excluded from the study. It was after obtaining the ethical review committee approval from the Liaquat University of Medical Health Sciences and ASRB, the study was initiated via calculation of Google Forms. Data was collected from the Google Forms, and it was analyzed by SPSS 26. These are the sample description. There were more majority of the population was female. So we asked a question that how does empathy change in medical students from first year to the second year, and the students responded that group B students in the final year responded that it decreases, significantly decreases in the time, over the time. While when we measured with the help of the Jefferson-Peters scale, the results were in agreement. The 116 mean score was there, which shows a high empathy level among group A, and which decreases over time in group B at 101.2. The t-test was applied for measuring the difference of means, and the result was statistically significant. We also inquired about stress level, emotional drain. Group B generally reported more stress levels, perceived stress level, and subjective feelings of emotional drain. Coming to the reasons of empathy decline, which was qualitative data analyzed via in vivo, we found out that heavy workload was found to be most reportedly by group B, followed by the lack of empathetic role. This was in line with the study by Sonia Ijaz-Haider in 2020. And the second, lack of empathetic role modeling was also in line with the study in a scoping review by Freire Valente in 2017. So these were the external factors, and the themes were external factors and internal factors. The internal factors theme was family pressure, limited self-care practices, and the mental health issues. Higher prevalences or subjective report of the mental health issues were reported by the group B students who were the final years, and they were in line with the Frege and Anderson. On the basis of these, the study concluded that empathy erosion is a multifactorial issue, with the clinical students disproportionately affected due to the heavy workload, increased stress, and disturbed work-life balance. Interventions such as empathy-focused curriculum reforms and mental health resources should be available to foster empathy in medical education. Thank you.
Thank you very much, Dr. Atar H. Rajput. Well presented. The next speaker is Dr. Sindhu Almas, Lecturer, Community Medicine Department, LAMS, and she will be talking on our experiences in running certificates in health profession education at LAMS.
Assalamu alaikum. My name is Dr. Sindhu Almas, and I'm lecturer at Community Medicine Department, Liaquat University of Medical and Health Sciences, Jamshoro, Sindh. The topic, actually, this is the study, narrative study, conducted on CHPE course, conducted by Dr. Anumal, and Dr. Hudaybia, Dr. Ikramullah Ujan, Dr. Shazia Mahmood, and I'm just the presenter. One of the core roles of health professionals working in medical, dental, nursing, and allied health sciences institute is a teacher. Teachers have a play multiple roles, for which capacity development is essential for understanding the basic applied concepts of health professions education. 6 months duration certificate in health profession CHPE course is necessary for faculty members to learn about the basic concepts and basics of applied concepts of health professions education. Objectives of and methodology. The objective of the narrative was to describe experiences of running CHPE course at Liaquat University of Medical and Health Sciences, Jamshoro, Sindh, Pakistan. Documents related to planning, approval, curriculum, and implementation of course and feedback of participants were explored. LUMS started CHP course in 2021. Committee designed curriculum, developed admission policy and implementation strategy in 2020. The course has 3 modules titled Teaching, Learning, Assessment and Curriculum. 3 contact sessions for each of 4 days face-to-face sessions are conducted with a gap of every 2 months. In between, vignette-based assignments are given to the candidates. The assessment consists of 3 components: internal assessment during each contact session, assessment of the assignments, and exit exam. Between 2021 and 2023, 144 candidates qualified in 6 batches. Written and verbal feedback was taken from the participants. The assessment consists of 3 components. Internal assessment during each contact session. Sorry, I think this is repeating. Why is that so? Okay, conclusion. Overall verbal feedback was positive and candidates seemed to be satisfied with content, process and proceeding of the course. Whereas long-term impact cannot be deduced from immediate feedback, further studies are required to explore that. We believe CHP course builds the capacity of professional of health profession education as a teacher. These are few pictures. This is the picture of a group work. These are the references. Thank you so much for your time.
Thank you, Dr. Sindhu. And now the next speaker is Dr. Zahida Birohi. Dr. Zahida Birohi will be talking on evaluation of the feedback of the participant of training workshops on developing blueprint for assessment.
Bismillahirrahmanirrahim. Assalamu alaikum. I must congratulate the organizer for arranging such a nice conference on medical education, and I also humbled for giving me opportunity to present our abstract. So this was the evaluation of the feedback of the participants of training workshop on developing blueprints for assessment at New World Kirkpatrick Model Level 2. So as we know, the medical education is the process of training people to become doctors or healthcare professionals. It is a lifelong learning journey that begins in the medical school to continuous throughout physicians' career and life. The goal of medical education is to prepare physicians to apply scientific knowledge, to promote health, and prevent and cure diseases. For enhancing the skills of the faculty members for developing blueprints for assessment, training of the faculty members is essential in this regard. In assessment, in term blueprints refers to a map or specification of assessment covering all aspects of the curriculum and educational domains like the cognitive, psychomotor, and affective of an assessment program over a specified period of time. So a one-day training workshop on developing blueprints for assessment arranged by Blawal Medical College, which is the baby of the LUMS and growing fast, Liaquat University Medical and Health Sciences Jamshoro, Sindh, Pakistan on December 5th, 2024. This training workshop was one among the pre-conference training workshop of the annual International Conference of Health Professional Education. So the objective of our study were to assess the feedback of the participant at New World Kirkpatrick Model Level 1 to 2, and it was the cross-sectional descriptive study, and the tool was used was the valid questionnaire, and data was analyzed on SPSS version 24. So here is the New World Kirkpatrick model, which has 4 levels. The level 1 corresponds to reaction. Reaction of a learner and of a tutor, and it has the engagement, relevance, customer satisfaction, while the level 2 is learning, like the knowledge, skills, attitude, confidence, and the commitment. And level 3 is behavior, and level 4 correspond to results, leading indicators, and desired outcomes. So here are the results of our workshop, training workshop. So the participant rating on the attributes of training workshop on a scale 1 to 10, 1 was the poor and 10 was the excellent. So regarding the usefulness, the score was 8.32, mean standard deviation 1 plus minus 1.61, and the content were 8, the mean deviation was 1.56. Regarding the relevance, it was 8.46 and the 1.50, and in facilitation, it was 8.50 to 1.36, and the overall response was 8.54. So the participant level of knowledge and understanding and confidence on the retro pre-questions, the knowledge and understanding about fundamentals of assessment before participation and after participation. So if you see, there is big difference. Before participation mean it is 2.4, and after participation it was 3.43 with p-value less than, very significant, less than 0.01. Regarding the knowledge and understanding about the developing blueprints for assessment, the before participation it was 1.96, and after participation again it is more than 3, mean 3.25, and with p-value less than 0.01. The confidence in developing blueprints for assessment, again the before participation it was lower, and after participation it was higher, that is 0.001. So with this I conclude my study. The immediate reaction of participant after participation in training workshop was constructive. Participant knowledge and comprehension were about fundamentals of assessment of blueprints for assessment significantly enhanced, p-value less than 0.001. The perceived confidence level of participant in developing a blueprint for assessment was significantly improved, p-value less than 0.001. And these are my references, and thanking you.
Thank you very much. Good presentation. And the next presenter is Dr. Uzair Abbas. Please come on the stage, and he will be presenting Impact of Peer Assessment on Lecture Quality and Students' Learning Outcome in Undergraduate Medical Education, a quasi-experimental study.
Assalamu alaikum and good evening. I am Dr. Uzair Abbas, Assistant Professor of Physiology at Dow University of Health Sciences, and I will be presenting my research, which is impact of impact of peer assessment on lecture quality and student learning outcome in undergraduate medical education. So these are the outlines of my presentation. So going for the background, the lectures are efficient ways of delivering knowledge, and good quality lectures have definitely impact on synthesis of new concepts and skills in medical students. So good quality lectures depends on the feedback of the students, and feedback is an important factor in medical education for evaluating the quality of lectures. But there are certain gaps in current assessment and feedback systems, as it is student-centered. There is lack of training to the students how to provide the feedback to the teachers or the lectures, and then it is random. Sometimes most of the students attend those feedback programs and most of them do not attend. And it is supposed to be the liability on the student. They have to attend this assessment program, so they just do the fulfill the requirement of these. Then there is no proper assessment because it needs to have a proper assessment tools. So few of these institutes have the assessment tools for the lectures and few does not. And most of the time it is taken for granted, and then there is no outcome and there is no improvement in the quality of the lectures. So that's why we formatted certain objectives for this, and those were to study the impact of peer assessment on the quality of the lectures. So we introduced that peers, like the lecturers or the professors of the same department and the same specialties, should observe the lecturers or the teachers to assess them, and then we also would like to see this impact of these peer assessment on learning outcomes in the medical students. So what we did, we involved 14 faculty members and 100 students divided into two different groups, contained 50 in each group, and then 25 minutes of lecture was provided from the specialty of physiology, anatomy, and biochemistry. So lectures were assessed by a 20 items 5-point Likert scale, and it was scored of 100 as a total, and then pre and post lecture knowledge assessment regarding the topic was performed regarding in those students. So what we did, that there was a control group and there was an intervention group. What we did in the control group, that we involved 50 students with 2 faculty members of the first year MBBS students, and they gave the topic which they were not taught before. And then the students were the only group to assess those faculty members, and then the second round of lecture was conducted after 15 to 20 days and incorporated after incorporating the feedback provided by the students. And then there was an intervention group in which again there was 50 students and then 2 faculty members, and they taught the same topic to the different group of students, and then peer assessment was performed by 10 faculty members, in which 5 were subject specialists and 5 were medical education specialists. So they performed the assessment of those teachers who taught the same topics which we taught in the previous control group. And then second round of lecture, after incorporating the comments from the peers as well as the students, this was also performed after the 15 days after incorporating the comments and the feedback. So these are certain results in which we can see in the first intercept what was the assessment score. We can see that the mean score was 67 for the control group and 65 for the intervention, and there was no significant difference in the result of the lecture quality. And then we can see that the student of the intervention group, we also compared the intervention group, we also compared the assessment score with the peers, and then peers has significantly decreased assessment score. It means that the peers have rigorous assessment of those lectures, so that's why they have probably the least score as compared to the students. Then if we talk about the knowledge retention, the topic which was taught, we pre-assessed them for that topic which was taught. So we can see that there was no significant difference in those control group as well as intervention group. So pre-lecture score was 43 and 47, and the comparison of post-lecture knowledge was also increased, but that was no significant difference in between the control and intervention group. And so the pre-lecture and post-lecture, there was enhanced knowledge. So the 20 days fed-off period was provided for the student as well as for the faculty. So faculty had to prepare and incorporate the comments provided by the peers and students just to fed off the previous knowledge. So we provided them as a second intercept in which the assessment score was significantly decreased. We can see that if we compare the post-intervention lecture quality score, so there was a significant higher lecture quality in the intervention group as compared to the control group, and then we can see that when we compare the post-intervention lecture quality in intervention group, so the students and peer has significantly scored higher, but there is no significant difference in between the peers as well as the students. And then we can compare the pre and post intervention lecture quality. So again, the lecture quality has certainly increased in intervention group as compared to the control group. Now, if we talk about the knowledge retention, the knowledge has certainly retained. We compared the knowledge before intervention and after intervention. So the knowledge has also raised. So moving forward, and what I would like to conclude our study. So we have shown that the peer assessment enhanced the lecture quality. It also enhances the knowledge retention and better assessment score. So we want to suggest that medical schools should consider implementing peer review to improve the teaching and learning outcomes. But most of the institutes are just reluctant or hesitant to introduce the faculty members or the peers to sit over there and to just observe their performance. So most of the institutes are just resistant for this. But these results suggest that peer assessment can enhance the lecture quality as well as the assessment score for the students. Thank you.
Dot on time and a wonderful presentation. Big hand for Dr. Uzair Abbas. The next speaker, he is Dr. Akbar Gohar Abdo. He is consultant physician and faculty member at Liaquat University of Medical and Health Sciences. He will be talking on burnout and associated factors in postgraduate medical students.
Thank you very much, sir, for your introduction. Assalamu alaikum. My name is Dr. Akbar Gohar. I am working as a senior registrar in Department of Medicine. Today my research topic is burnout and its associate factor in postgraduate medical student residents. Today outline of my presentation is undergraduate medical education in particularly is notorious for the being long and emotionally taxing. Medical students often encounter intense and demanding circumstances in the course of their academic studies. This leads to the report of the high level of stress and psychiatric morbidities in terms including but not limited to depression and general anxiety disorder. In cross-sectional question-based study conducted in Surat Medical College in 2012, almost all medical students reported a stress experience, out of which 40% was severe in nature, while in another study found nearly half of the students in medical school to be have the anxiety and depression. The word burnout first time come by the American psychologist. The term burnout is broadly described as a state of the chronic stress leading to the physical and emotional exhaustion, cynicism, detachment, and feeling of inadequacy and lack of accomplishment. A study published in 2024 based on the national survey carried out in the USA found that medical students, residents, fellows, and the physician with less than 5-year practice were more likely to burn out compared to the general population. Rationale of my study is while there is growing body of literature on burnout among the healthcare profession globally, there is a notable gap in the research focusing specifically on the postgraduate medical resident in Pakistan. Existing studies often lack the specifically to this population, failing to provide the comprehensive understanding of the prevalence and the contributing factor of burnout among the medical resident. Object of my studies to assess the prevalence of the burnout among the postgraduate medical resident and associated factor contributing to burnout. Operation definition, emotional exertion, it refers to the fatigue at very idea of work, chronic fatigue, trouble sleeping, and the physical problem. It is basically part of the Maslow's inventory. If the score is less than 17 or 7, it shows the low level of burnout. If a score is between 18 and 29, it shows the moderate burnout. If a score is around 30, it shows the high level of burnout. Depersonalization is synonymous to loss of empathy. If a score is less than 5, it shows the low level of burnout. If a score is between 6 and 11, it shows the moderate burnout. If a score is 12 or greater, it shows the high level of burnout. Personal achievement. Personal achievement signifies an individual evaluation of their ability to progress and succeed. If a score is 33 or less, is high level burnout. If a score is 34 to 39, it is a moderate burnout. If a score is greater than 40, it shows the low level of burnout. My study is cross-sectional, conducted in Liaquat University of Medical and Health Science from 15th of July 2024 to 15th of October 2024. Sample size is about 26. Postgraduate were included. Sample size was calculated using the WHO sample size. Sampling technique is non-probability purposive sampling. Inclusion criteria, all those postgraduate who have worked for the 6 months in their department were included in the inclusion criteria. Also those postgraduate who have given the consent. Exclusion criteria, all those who have not given the consent are those students who informed that they have a medical problem or psychological problems. Data collected, data was obtained from the student meeting eligibility criteria using the standard structured question containing inquiries about the socio-demographical details, education problems, and year of training. Data analyzed in Microsoft Excel 2016 and SSP version 2.25. This is demographical chart showing that the age of the postgraduate is between 25 and 40. Male and female both were included. Urban population was more, around 64%. Middle class is around 57%. Burnout is seen in 27% of the population in students. This is a subclasses of emotional exertion, shows 23% high burnout, and depersonalization shows 16.67% burnout, and personal achievement shows the 27.0% of the burnout. Around 42% were told that the program is supportive and positive. Adequate resources were provided is said by around 25%. Conclusion, burnout is a prevalent issue among the postgraduate medical resident at the LUMS, both moderate to high level observed in the significant population. Socio-demographical and work-related factors, including the workload and nature of job, contribute to burnout. Strategies focusing on the mental health support, workload management, and fostering the positive workplace atmosphere are recommended to mitigate the burnout and improve the resident well-being. These are the references. Thank you very much.
Thank you very much, Dr. Gohar, for a wonderful presentation. The next speaker is Dr. Sara Khalid. Please come on the podium, and she will be talking on surgical audit at Civil Hospital, Thatta, Sindh.
Assalamu alaikum everyone, and a very good afternoon. I'm Dr. Sara Khalid, working as a senior registrar at Department of Surgery, Liaquat Institute of Medical and Health Sciences, LIMS Thatta, and I'm here with the topic of my research, that is surgical audit at Civil Hospital Thatta. Before going into the detail of this study, we must have a brief introduction that why this topic was done, why the study was done. So as we all know, it's a well-known fact that Thatta is one of the most historic cities of Sindh, which has a rich history and culture. But because of some administrative malfunctions or something, today, unfortunately, it is one of the most neglected areas of Sindh in terms of health and education. In such a scenario, Liaquat Institute of Medical and Health Sciences, LIMS, was born as a constituent college of LUMS in the year 2023, which was then recognized by PMDC in 2024. As a result of this, the DHQ Hospital of Thatta, which is located in Makli, was converted to a tertiary care hospital, providing the services to the underprivileged people of the Thatta. And this gave a way to the research that what type of changes have been brought in terms of surgical department and surgical services. So a study was conducted, and the purpose of this being to conduct an audit of the surgical ward and the services being provided after its upgradation. These are the objectives of my study: to evaluate the demography and diagnosis of the surgical patients at civil hospital, to evaluate the surgical procedures that are performed, and to compare and contrast the pre-PMDC approval and after PMDC approval scenario. So as the methodology was done, and it started from the ethical review committee, a letter was taken, and then the cross-sectional study was started. The data was collected from the hospital record after the approval of the head of department and taking consent from the patients. And then from April 2024 to September 2024, the data was evaluated using SPSS 16 software. Only there were the descriptive variables, so the frequency and percentages were taken from the SPSS 16 softwares. This is a slide which is important overview of the results, in which we'll be discussing the number of OPD patients which increased grossly, the operative procedures, the number of operative procedures, and the type of operative procedures that were done, the number of patients admitted per month, and the variety of the surgical cases. So a total of 730 patients have been admitted from April to September 2024, most of them being male, making a 59.5%, and 455 of them out of 730 were surgically intervened. This is important, that more than half of the patients were surgically managed. Any of the major or the minor surgical intervention was done in that. And here is another one of the demographic results, which says that in our ward, the patients were not only from the Thatta city, because Thatta city is also present in Thatta district, and most of the patients covered most of the cities of the Thatta district, the highest number being from Thatta, then from Gulamula, and then from Makli. This is a bar chart that is showing the monthly patient admission rate, which ranged from 101 to 139, highest being in August. Here, the compare and contrast is important, and that this is another chart of 3 months data taken from January to March, which is showing the average rate of admission per month before upgradation was 72.3, which visibly increased to 121.67 after the upgradation. Then another thing which was a part of our objective is to see the surgical diagnosis or the variety of surgical cases. So it is the highlighted text is showing us that not only the elective cases, but the acute abdomen, acute appendicitis and pancreatitis type of things which come in the acute surgical cases, and the emergency surgical cases are not also admitted. And the major cases like gastrointestinal stromal tumors, the GIST, the multinodular goiter, the parotid swellings, colorectal carcinomas and breast carcinomas are also being admitted in a ward. Here again the contrast is important, that before the upgradation, this table is showing us that before that only the perineal surgeries and the benign breast lump diseases were being dealt. The total number of surgical procedures performed are 459 in our study, and this is a list of the procedures that were being done. Here I would also like to show this pie chart, which is showing a compare and contrast. This is a chart showing our audit study compared to this one, which shows that prior to the PMDC approval, only these type of surgical procedures were being performed. Here the important thing is not the variety only, but also the improvement in the technique. Here we can see the people from the surgery know that this is a darning repair, which is a non-mesh repair of inguinal hernia, which was used to be done before the upgradation. After the upgradation, it has been changed to Lichtenstein mesh repair, which is the gold standard technique used for inguinal hernia repair. Since October 2024, advanced surgeries like parotidiectomy, sigmoidectomy, and anterior resection, and also the tunneling by procedure for the varicose veins is also being performed. We conclude this audit which is telling us that the number and the variety of the common surgical diseases that have been presented to our hospital in the region of Thatta, the improvement in the rate of admissions, the variety of patients, the procedures, not only the number but the variety, and upgradation from minimal to extensive surgical techniques, which has overall improved the quality of care in the people of Thatta. There are a few limitations of this study, as we saw that we have compared a 6 months data with a 3 months data. The reason being that since it is a new hospital, so there was, prior to the PMDC approval, there was no proper record keeping, so it was very difficult to retrieve the old data, but eventually we have taken an average and compared it with, but this is also giving us way for further study because the research area is empty at that region. So thank you so much. This is the main gate of our campus. Thank you so much.
Indeed, nice presentation, Dr. Sara, and it was worth to listen from the newly established Thatta campus of Liaquat University, Liaquat Institute of Medical and Health Sciences. The upcoming presenter is Dr. Sabahat. She will be presenting on a cross-sectional study on level of stress and anxiety in medical students. Dr. Sabahat.
Assalamu alaikum everybody and good evening to all of you present. I am Dr. Sabahat from Department of Physiology at this LUMS, and today I am here to present a topic that is a cross-sectional study on the level of stress and anxiety in medical students. Now these are the contents of my presentation. Now I'll briefly introduce my topic. Now stress is very prevalent in students because they face a lot of challenges academically and professionally. Now due to this increased level of stress, they also have a lot of negative outcomes like depression, anxiety, fatigue, exhaustion, which can lead to a lot of physical and mental problems as well. However, the chronic stress can worsen over time and cause many cardiac problems, gastric problems, and also dysfunction of immunity. Stress also has many detrimental effects on social and personal relationships as well. Now, the main objective of my study was to calculate the level of stress in medical students. Okay. So to do that, we designed this cross-sectional study, which was conducted at LUMS from July 2024 to December 2024. In this study, we recruited students from LUMS by a stratified random sampling technique. Their informed consent was taken and questionnaire was filled out. I'm really sorry about my voice right now. Okay, so methodology, we did descriptive statistics in which we summarize the data, and inferential statistics were performed to assess relationship between stress level and demographic variables. Now some chi-square test was also performed, and the scores of the scale was categorized into four categories. Again, I apologize for my voice. Yeah, a little bit of water, thank you. Okay, so these are my results. Basically, 403 participants took part in our study, out of which 256 were females and 147 were males. This table shows the basic characteristics of participants. Even distribution of year of study was present in my study. Most of them were from first year, 21%, then 20% were from second year, and 20% from final year. According to academic performance, 50% had A grades, whereas 27% had A+ grades. According to attendance, 92% had very good attendance. Okay, this table shows the categories of stress, which showed that 32% had no stress and 59% had no issues with their physical health whatsoever. But it's important to note that 19% had severe stress, whereas 23% had moderate stress and 25% had mild stress. Okay, so now this table is very important because it emphasizes the relationship between stress and variables. It shows that females are experiencing more stress because they have increased odds ratio than the males, 2.1. It also shows that the students of first year were experiencing more stress than the other years with 3.9 odd ratio. And also followed by second year with 2.5 odds ratio. Now the grades and attendance did not have any significant value because the p-value was found insignificant. Whereas the physical issues, the people that had physical issues showed more stress with 1.9 odds ratio. Okay, so further we performed the multivariate analysis where we controlled many factors. We found that the odds ratio of female increased from 2.1 to 2.5. These are the adjusted odds ratio. It also showed that the first year and fourth year were experiencing more stress due to increased odds ratio. And also the people that had physical issues were experiencing more stress. Now this is the conclusion. Now, the findings of this study suggested that a significant disparity of stress was present among different genders and physical health and academic performance, while the grades and attendance did not have any significance. These findings suggested that they are giving us a target population that we should target females and students of first year and help them effectively manage their stress. These are the references. These are the details about the questionnaire, about the scale. And this is the scale. Thank you so much for your attention. I was the one that was stressed.
Thank you very much, and we appreciate Dr. Sabahat for good presentation. And now the next presenter is Dr. Sumaira Naeem Khan. If she is available, yes. She will be talking on modular curriculum.
Assalamu alaikum everyone. I'm Dr. Sumaira Naeem Khan from the Department of Pharmacology and Therapeutics and Liaquat University of Medical and Health Sciences. I'm a PhD candidate there. My topic is modular curriculum and its impact on students' outcome. Globally, the modular curriculum has obtained a particular importance. The modularization pursued on the fundamentals of splitting the curriculum into the small units that are self-sufficient and concise. By the emergence of modular curriculum, students are capable to focus on their studies and are flexible to pick out the most appropriate module of their target to success. It is also included in the benefit of modular curriculum that the students can focus on a single topic at a time, which would be helpful to understand and retain the topic. All the universities and institutions can gear up the modules to meet the particular requirements and interest of students to attain education, training, and providing powerful assistance in their future, and reduces the stress of studies to perform better in their future. The objective of my study is to observe the knowledge and response of students about the modular curriculum and its impact on their future career. My hypothesis is because of the flexibility and compatibility of the modular curriculum of the students will have a positive impact on their way to success. My methodology is a cross-sectional study in the pharmacology, Department of Pharmacology LAMS, where we conduct a non-probability convenience sampling technique was used, and a sample size of 200 students, including both male and female, was selected. The questionnaire was plotted. Data was gathered by self-administrated questionnaire made after vigilant evaluation. Questions were asked by all the participants about the impact of modular curriculum in for the successful student's life by using 7 points Likert scale reflecting opinions like strongly agree, disagree, somewhat disagree, neither agree, disagree, till strongly agree. And my results were shown by the graphic presentation. I just took one question and made a graph from that. I took the question, impact of modular curriculum on success of a student. I asked so many questions, almost 14, about the students, from the students, and take data from that, and plotted a bar graph. So my conclusion was, it is proved that majority of the students are in the favor of modular curriculum and considered it as an integral part of their success, and it can improve their curricular activities and the future challenges. Thank you.
Thank you very much, Dr. Somera Naim Khan. And the next presenter is Dr. Saba Sumro. We are now getting closer to the conclusion of this session. Dr. Saba Sumro will be presenting on training workshop on conducting workplace-based assessment using mini-clinical evaluation exercise tool.
Good evening, everyone. I'm Dr. Saba Sumro, and I work as a lecturer in the Department of Faculty of Dentistry. And today, the topic which I'm going to present in front of you is about training workshops on conducting workplace-based assessment using mini-CAGs. And before I move on, let me throw the light on assessment. Assessment word, actually, if I briefly describe this word, assessment is actually to judge the performance of teachers as well as learners in the work environment. And this workshop was conducted on workplace-based assessment using mini-CAGs. Mini-CAGs is actually one of the assessment tools which is used in workplace-based assessment. And in workplace assessment, there are multiple tools used for the assessment. However, we only use mini-CAGs, mini-CAGs is actually the mini clinical evaluation exercise, which is a structured assessment tool. And apart from this mini-CAGs, other assessment tools which are used in workplace environment include CBD, OSET, logs, or portfolios could also be used. However, in this workshop, we only focused on mini-CAGs, which is actually mini clinical evaluation. And mini clinical evaluation or mini-CAGs is actually a reliable, valid, effective, and the feasible methods, and it could be successfully used in any workplace-based assessment. And because as in the introduction, I mentioned that this was actually the workshop which was conducted in Blavel Medical College. So the data was actually gathered during the workshop which was conducted in the Blavel Medical College. And the objectives which were formatted were to assess the level of knowledge of participants who participated during the workshop, also to know the level of knowledge of participants, also to assess their level of knowledge on Kirkpatrick's model. Let me briefly discuss with you the Kirkpatrick's evaluation model, which was already discussed by Dr. Zahida Brohi. So the Kirkpatrick model for the evaluation was developed by Donald Kirkpatrick, and it has 4 levels, and these 4 levels are used for the evaluation of workplace-based assessment. So the first level says reaction. In the first level, we usually evaluate the learner's attitude as well as behavior towards their learning environment. And the second level says the second level usually measures the level of knowledge, skills improved, or the behavior changed as a result of that as a result of that learning experience. And the third level says the behavior. This level usually measures the change in the behavior of the learners as well as in the teachers. And the third, and the fourth and the last level usually measures the impact of all the learning experiences and all the learning behaviors on the bottom line. Or briefly, the fourth level usually measures the impact of that assessment tool on the institution or the learners. So the materials and methods so the objectives of this data analysis were set to assess the level of knowledge of the participants who participated in the workshop. And the second object was set to assess the feedback of the participants about the Kirkpatrick's evaluation model. So in the previous slide, as it was brought up, that Kirkpatrick model has 4 levels, but in this study, we only included 2 models. So we included only 2 levels of the Kirkpatrick model. So the first level was about to assess the attitude and the behavior of the learners. And the second level was to measure the knowledge acquired, the skills improved, or the behavior changed as a result of that assessment tool. And the materials and methods, so the type of a study which we conducted was descriptive cross-sectional study, and the tool used was a self-developed questionnaire which was used during the workshop, and the data was analyzed using SPSS version 23, and measures of central tendency and the pair t-test were used. And the results were, the pre-test score was, the standard deviation was taken out before the test scores and after the test scores, and the p-value was found to be significant because it is less than 0.001. And then we analyzed different attributes of the participants during the workshop. And one of the attributes was usefulness, which was assessed using Likert scale. Starting from 1 to 10, 1 was assessed to be the poorest, and the 10 was found to be excellent, and the mean and the standard deviations were calculated. So the attributes were usefulness. Usefulness was found out to be 8.75, plus minus 1.57, and the content was 8.75 plus 1.48, and the relevance was found out to be 8.81 plus minus 1.51, and the facilitation was assessed to be 8.69 plus minus 1.74. So these were the attributes of the participants which were analyzed or which were assessed during the workshop. And then we also assessed the level of participants' knowledge about different assessment tools which are used in workplace-based assessment. So one of the workplace-based assessment tool used is PBA, that is performance-based assessment. So before the participation, standard deviation was found out to be 1.63 plus minus 0.72. And after the participation, it was found out to be 3.06 plus minus 0.57. And the p-value was found out to be significant because this shows less than 0.001. And another workplace-based assessment tool was mini-cakes. And in mini-cakes, before the participation, it was 1.44 plus minus 0.51. And after the participation, 3.25 plus minus 0.58. And the p-value was found out to be significant because this shows less than 0.001. Okay, so before I conclude, let me briefly summarize all this presentation. So this presentation was about the workplace-based assessment, and we have different tools to assess the teachers and the learners, and one of the tools we used was mini-cakes. Mini-cakes is actually mini clinical evaluation, and this mini-cakes could be used in overall clinical care. Overall clinical care means this could be used in history taking, communication, professionalism, as well as physical examination. So this mini cakes could also be successfully be adopted in this work environment according to the relative feasibility. Thank you very much.
Thank you very much, Dr. Sabha. So persuasive. Now, Dr. Sajan Sarang is requested to come forward. He is a master's in public health as well as my student, and he will be talking on factors influencing the quality of life of children with beta thalassemia major in district Tharparkar, and couple of last presentation of him.
I am Dr. Sajan, working as a pediatrician at Civil Hospital Mithi, Tharparkar. I will be talking about factors influence the quality of life of children with beta thalassemia major in district Tharparkar. This is my introduction, complete MBBS in Liaquat, University of Medical and Health Science in 2015, and MCPS PhD in 2021 from NICH, and recently finished MS-PH from Lumps University, and currently working as a pediatric physician at Civil Hospital Mithi. Background: thalassemia is a genetic disorder characterized by the reduced or absent globin production, which leads to severe anemia. In Pakistan, there is 5 to 7% of population, which is over 10 million carrier. And if we talk about globally, there is 4.4 per 10,000 live birth. There are 3 types of thalassemia: alpha, beta, and delta. They present with poor growth, severe anemia, visceromegaly, hemolytic anemia. My object to investigate the factor influence the quality of life of children with beta thalassemia major in district Tharparkar, focusing on demographic, socio-economic, educational, and emotional. This is a descriptive cross-sectional study in district Tharparkar. Duration of study is 6 months. My sample technique is non-probability purposive sampling technique. I included all the caregiver of children diagnosed with beta thalassemia major and age range from 6 months to 18 years with resident of district Tharparkar who was using healthcare facilities at DHQ Mithi, and informed as well written consent taken from participant. I excluded those who have impaired cognitive, functional, or severe clinical condition that may limit their ability to participate in the study, and those who are refueled. Data collection procedure, we have assessed these all by using a WHO quality of life tool, which have 26 items, and there are 4 domains: social, psychological, physical, and environmental. The results: total number of participants were 190. The majority of participants were male, 112, and females were 78. And the median age at diagnosis and initial treatment was 6 months. The majority of participants were fathers were laborer and farmer by occupation. None of participants has undergone premarital thalassemia screening. A majority, 75% receive therapy monthly, while 24% have weekly treatment. This is a graphical presentation of my data. There are only 24% who were weekly treatment, weekly transfusion, and the level of education, there are only 74 participants who have no formal education. And this is the, if we put our data into a scoring system, and there is a score, if there is a less than 20 score, they have a very poor quality of life. If score is more than 60, they have good quality of life. And in our research, total score is 60. Conclusion: challenges and support needs. Children with beta thalassemia major in Tharparkar have faced significant challenges, including financial hardship, limited education opportunities, emotional distress, social issues, and they need a support system, and targeted intervention should be done. To improve the quality of life for these children, a coordinated response is needed, including healthcare improvement, genetic counseling program, education reforms, and mental health services. A recommendation, target intervention, and there should be more studies on that. Perimeter screening system and treatment frequency should be according to guideline. Thank you very much. This is a reference.
Thank you, Dr. Sajid Sarang, and the second last presenter is Dr. Nudrat Zeba. She will be talking on participants' level of confidence after participation in trainings workshop on assessment in health professions education. Dr. Nudrat Zeba.
Bismillahirrahmanirrahim. Myself, Dr. Nudrat Zeba, working as Associate Professor and Module Coordinator at the Department of Community Medicine, Bilawal Medical College, Lums, Jamshoro. Today's my presentation topic is Participation Level of Confidence after Participation in Training Workshop on Assessment in Health Professional Education. My authors are Professor Dr. Ranomal, Dr. Sunil, and third me. Introduction. Assessment is a basic component of teaching and learning as it focuses on what learners learn and how they are certified. Training of faculty members in this regard is indispensable in health professional education for enhancing skills of the faculty members in developing assessment tools. Bilawal Medical College, working as a constitute college of Lums, organized a 2-day training workshop on assessment in health professional education. Material and methods. This descriptive cross-sectional study was conducted with objective to assess the feedback of the participants, especially their confidence level, in developing different tools of assessment at the New World Kirkpatrick model level 1 and 2. Material and methods. This training workshop was held on November 8th and 10th, 2022 at Bilawal Medical College, Lums. A valid questionnaire was used to collect feedback from the participants. Feedback data was analyzed using SPSS version 24 for the central tendency. A paired t-test was used for the comparison of the responses of the retro pre-questions. Objectives of my study. The general objectives of the training workshop was to enable the participant faculty members of BMC to enhance their assessment skills. The specific objectives of workshop were explain the fundamentals of assessment, update the skills in writing and developing MCQs, describe the item analysis of the MCQs, update the skill in constructing objective structured clinical examination, objective structures, practical examination, describe task-oriented assessment of clinical skills, explain the screening process of research protocol. Results, demographic characteristics, age of the participants are, the mean is 40.00 plus minus 9.03. Male are 7, female are 20. Teaching experience in years 5.12 plus minus 4.63. Research experience are respectively 2.71 plus minus 3.94. Rating of the workshop, usefulness 8.65, content 8.65, relevance 8.65, and facilitation 8.76. Overall 8.88. The level of retro pre-questions on specific session of the workshop, before participation in the training workshop, after participation of the training workshop. Level of the confidence in developing multiple choice question, 2.35 plus minus 0.6 before the participation, and after participation of the workshop 3.59 plus minus 0.51. The level of the p-value is highly significant, 0.001. Level of confidence in item analysis of MCQs 2.06. After participation 3.47. Level of confidence after developing OSCE and OSPE 2.12 plus minus 0.69. After participation of training workshop 3.41, 0.71. The p-value is highly significant, 0.001. Level of confidence about screening research proposal 2.06 plus minus 0.96. After participation training workshop 2.94 plus minus 0.75, less than 0.001. The scale was, their confidence level, I Likert scale was using 1 to 4. 1 is not confident and 4 is extremely confident. Conclusion of my study, immediate perception of the participants after the training workshop was positive and perceived level of confidence in developing different tools of assessment was significantly enhanced. These are the references. Thank you.
Thank you very much, Dr. Nudrat Zeba, for our wonderful presentation. Dr. Uruj Bhatti, faculty member at Department of Physiology, LAMS, is requested to come forward, and she will be presenting on perceptions of students towards computer-based examination system at LAMS.
Assalamu alaikum and Bismillahirrahmanirrahim. I will start my presentation with the name of Allah. A'udhu billahi minash shaitanir rajim. Bismillahirrahmanirrahim. Qala rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. The topic which I am going to present in front of all of you is the perception of students towards the computer-based examination system at our very own LAMS. In medical teaching, the assessment is playing the very important role. The traditional methods of assessment are paper and pen based, either by short essays or by the MCQs or single best choice questions. In medical teaching, an assessment is a challenge. Why? Because in public sector, it is difficult to accommodate large number of the student in case of changing pattern of teaching and assessment, like we are turning our annual system from the semester then to the modular system. And due to lack of funds, it is also very difficult to conduct these things. Policies are directed by the higher authorities. Now, what is computer-based assessment? It is the use of digital tools for the assessment-related activity. A computer-based test, which is also known as CBT, refers to delivering assessment with the computers as an alternative to using the pen and paper method. Such a test can be conducted online using the internet or computer-assisted facility as we have here. It is a time-efficient and effective means of hosting large-scale online examination. As we all know, today is the era of computer-based learning. In this era, our student would love to learn on the computer. So there should be computer-based assessment. So I'm going to present lovely results. For the first time in the history of public sector, our university has started this system. Okay, this is our state-of-art examination center. This is the efforts which our worthy Vice Chancellor has taken for our university. With the advances in medical education, the CBA of the student has been introduced and implemented at Liaquat University of Medical and Sciences, and this study aimed to explore and analyze the students' perception regarding CBA at LAMS. Objectives of my study was to explore students' perception regarding the CBA and to assess the perceived advantages and disadvantages of CBA among these students. Methodology, regarding methodology, this was cross-sectional observational study, and after approval from the ERC, the data was collected by providing the questionnaire on the Google form.
The data was stored and analyzed by using SPSS and counted with the percentages and reported on the gender area of living in the past 5 years, current academic program. Okay, coming to the results, 55% were female who has responded. Okay, 43 were from the rural areas, students, and 56 were from the urban areas. And if you see, our first year students has replied in majority. Around 120 students from the first year had replied on the Google form. And MBBS students, majority of the MBBS students has responded. All others also has participated from the Allied Health Science, Dentistry, Form D. Okay, coming to that, the first question was, how familiar are you with the computer-based assessment used in your modular exams? Majority were familiar. See, only 19 were not familiar, majority were familiar. Question was, do you believe that computer-based assessment have improved your academic performance compared to traditional paper-based methods? Yeah, only just 7% says no. Otherwise, this, if you will combine, yes, it has a significant improvement, and yes, it is a moderate improvement, it is more. And just 25% said no, it has no effect on our academic performances. Would you recommend the continued use of computer-based assessment in your academic program? Yes. Majority says yes with major and minor improvement. Only 10% said no. Okay, the next question was, how would you rate the ease of the use of CBA platform? 45% says it is very easy to use. And what is your prior level of computer skills? 49% said we know the basic things. We know the basics of the computer. Do you feel that the training orientation provided for the CBA was sufficient? 60% said yes, it is very well known by us. Which type of exam format do you prefer for the modular exams? 73% said CBA. Okay, how you feel about the fairness of the CBA compared to traditional exams? 37% say it is much more fair. Regarding the stresses or any problems, just 34% said it is little bit, there were stress and anxiety was there before the CBA because it was the first time it was conducted, and I have collected this data before the final exams, means after the modular exams. How often do you encounter technical issues? They were saying rarely. 36% say rarely we have any technical issues. Do you believe that CBA provided better opportunity? Yes. Majority says yes. Only 19% says no. So overall, students suggested that, okay, this I must show you. These are a few responses by the student suggestions that we need mouse and tapping both, and there should be a red flag system. We want to tag this one. We need red flagging, means they need highlighted, they need something to highlight the answer so they can easily go back and answer the questions. So this study concluded from the student perspective, CBA is more user-friendly and fair way of examination at LUMS. I'm thankful to the students of LUMS who participated in the survey, and special thanks to our worthy Vice Chancellor who has started this excellent computer-based assessment which is not available in any other public university yet. Thank you.
Thank you very much, Dr. Uruj Bhatti. She was presenting so well. And the last but not least is Dr. Sarang Suresh. He will be presenting on implementation and assessment of comprehensive care teaching model. This is last presentation, and after that we will have the certificate presentation, certificate distribution, and an announcement.